So I have 1:30, and if you are back with us, could you signify by turning your cameras on, please? Okay, where is Diane Prado? There's, okay, everyone's here. All right. Can we convene now? We're going back up to agenda item number 4. Is our DCA representative here? I see that she is. Very good. I think she has some very good news to report to us in regards to compliance. Take it away.
Hello. Okay, yes. Yes, we will get to the compliance. Well, good afternoon. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs, and thank you for allowing me the opportunity to provide a department update to your board today. And as just an aside, thank you too for your flexibility. Today just happens to be a very busy day, or a very popular day rather, for board meetings, and so Board and Bureau Relations is bouncing around, and so I appreciate your flexibility. First, I'd like to talk a little bit about COVID-19 safety measures and telework. DCA appreciates all board members, committee members, and staff who have continued to serve through a pandemic that has affected all of us in many ways. We are working together to find the right balance of staying connected and productive while keeping safe and healthy. And DCA and its boards and bureaus continue to look to the future and use lessons learned to identify long-term efficiencies and policy changes. Staff are working in the office to provide the most effective consumer protection and public service while also utilizing telework where appropriate. And DCA is assembling a task force to help the department create a telework policy that will provide further clarity and structure for managers and staff, and it's expected to be finalized next fall. Next, I'll discuss testing and vaccination verification. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or be subject to regular COVID-19 testing. DCA's testing program kicked off in early October with the launch of the DCA Headquarters 1 locations pilot site. And select programs have been designated to test at Headquarters 1, and that list of programs recently expanded due to the capabilities of the site. Other sites will begin testing at a later date to be determined. Board and committee members must follow health and safety protocols if they plan to visit a DCA location or attend an in-person meeting. Members must verify vaccination or follow testing protocols in accordance with that location's requirements. Please communicate any plans for in-person meetings as soon as possible so that DCA can assist with coordination of teleconference options for the public, vaccination verification, and COVID-19 testing. Next, I'll discuss remote meetings. So DCA recognizes the difficulty of planning for future meetings as the pandemic continues to evolve. As the law stands today, remote meetings are allowed until January 30th, 2022, after which time meetings will need to be in person in accordance with all aspects of the Open Meetings Act. We don't know what additional changes to the law may be coming, but I think we all recognize there are benefits to remote meeting options, such as an increased public participation, cost savings, and a lower carbon footprint due to reduced travel. DCA encourages boards and bureaus to continue utilizing remote meetings this year to protect the health of staff, board members, and the public. And we will keep you updated on any additional changes to meeting requirements as soon as we become aware of them. And next, I'd like to touch on Scam Alert. DCA has been made aware of various scams affecting boards and bureaus. We have shared information about these scams on the DCA website and social media. So when you have a chance, please take a moment to visit the DCA Fraud Alert website, which you can find by going to DCA's website, dca.ca.gov, to learn about these scams and how to protect yourself from malicious individuals. And finally, I'd like to provide a reminder and a congratulatory statement, as with Kita, about required board member trainings and learning management system. So first, my reminder. 2021 is a mandatory sexual harassment prevention training year. This means that all DCA employees and board members are required to complete the training this year, which is rapidly approaching its end. As you may be aware, this training is now accessible through the Learning Management System, or LMS for short, which is DCA's training portal, and we created profiles for each of you in the LMS. So having conveyed these reminders, I would like to acknowledge the hard work and efforts that you as board members have put forth to achieve nearly full compliance with all mandatory training. So congratulations to you all. And DCA thanks you for your ongoing commitment to your role, which includes the completion of these mandatory trainings. And while I'm offering up gratitude related to trainings, I'd also like to acknowledge Executive Officer Jessica Siefman for her invaluable contributions toward the DCA's Board Member Orientation Training, or BMOT. Among other projects Ms. Sieferman assists the department with, she is also a BMOT presenter and assisted us in carrying out another successful offering of this training just this past week. So thank you, Ms. Sieferman, again for your time and contribution. And that concludes my presentation. As always, Board and Bureau Relations is here to help you, and if there's anything we can do to assist your board, please do not hesitate to reach out. So with that, I'll hand it back over to President Nunez. Thank you for your time.
Thank you, Brianna. I told these board members to get that training done, and they finally did it.
Yes, as I said, congratulations to you. I know it can be a bear to get it all done, but you know, you guys did it, and we appreciate it.
And of all the boards that you attended today, I'm sure that we're your favorite.
Absolutely.
Thank you.
Thank you.
Are there any questions from the board members for Brianna Miller? Do we don't open this up for public comment, do we? Yes, we do. Moderator, could you please?
Sure. All right, the Q&A panel is now available. If any member of the public wishes to make a comment on this agenda item, please type comment in the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions and we'll give you a moment. All right, I see no request for comment at this time. Mr. Board President, shall I close the Q&A panel?
Yes, please.
Okay, it's
moving on to agenda item 9, discussion and possible action regarding pharmacies requiring NPI and DEA numbers to fill veterinary non-controlled prescriptions. And we've all been there before, writing a prescription for a non-controlled medication that a client has requested. And again, we are mandated to provide a written prescription if the client asks for one. And they ask for these prescriptions for various reasons. Sometimes they can find better prices at Costco or what have you, only to find out that the pharmacy won't fill it because they need either a DEA number or an NPI number, which Jessica is going to tell the story behind that. I know that Dr. Miller from CVMA went down this path before. He was Lewis and Clark expeditionary for it, and we're trying to colonize the land now. That's my introduction.
Well, thank you. And I really want to thank Anita Levy-Hudson and CARB-DEF for bringing this to my attention during our monthly meeting. So as Dr. Nunez had said, the problem at the crux of the issue is that human pharmacies are requiring an NPI number or a DEA number for controlled and non-controlled substances. Veterinarians, as the professional members know, do not have an NPI number, nor could they get one if they wanted one. The NPI number is for human billing for Medicare and Medicaid, and veterinarians don't treat humans and would never do so. So that creates a problem, because what happens is that the veterinary team prescribes this. The client goes to a Costco or Walgreens or another chain drugstore to try to get a discounted price. And the pharmacies are requesting this information. That translates to them contacting the veterinarian's office and then having to spend quite a bit of time explaining that veterinarians do not have NPI numbers and they do not need a DEA number, nor should they use a DEA number for non-controlled substances. So at the end of the day, it comes down to a pretty significant delay for these animal patients who need the necessary medications, they do not receive these medications timely. So with that, it kind of started going down this long rabbit hole that a lot of people have gone down, as I found. So it first went with me reaching out to CVMA and seeing if they are experiencing the same issue, and of course they are. And it's an ongoing issue that I think everybody is trying to get addressed. Then I reached out to the executive officer of Board of Pharmacy, and we arranged a meeting with Dr. Nunez and Sodegren from Board of Pharmacy and their board president as well. Their board president is also a pharmacist, and he had acknowledged that even in his as a younger pharmacist, he remembers getting yelled at by veterinarians for requiring the MPI number. He definitely understood the problem, and he and Anne then went on to explain how big this problem is. It's not just California, it's statewide. And they explained that the issue, and oftentimes the clients and the veterinarians aren't aware of, is in order for Costco or Walgreens or CVS to offer a cheaper price for the prescription, there's programs that allow them to do that, whether it's the biggest example that they provided was GoodRx. But it sounds like, based on conversations, there's hundreds of these programs out there, and it depends on what chain stores are they're contracting with to offer these different services. And it's those programs that are requiring this information in the database. And so what we've been told is that the human pharmacies, they're trying to get these discounts for the clients so they don't have to pay that higher price. And so they're doing a few things. They're either making up an NPI number or they're requiring a DEA number to be put in there. Those are, from the DEA's perspective, they highly discourage anybody from using the DEA number for anything other than controlled substances. It weakens the whole purpose of the DEA number was to track the controlled substances being prescribed and dispensed. And without that, if DEA numbers are going into non-controlled substances, it'll weaken the whole purpose for that. The NPI number 2, no, we would never want to recommend that anybody make up data in any kind of system. So with that, they recommended that we reach out to the National Association of Chain Drug Stores, also some national representatives of specific chain drug stores, and other programs like GoodRx to see if there's ways for us to remedy the situation. Dr. Nunez and I then met with national representatives from CVS and the National Association of Chain Drug Stores, which I didn't even know existed until we started down this rabbit hole. And they were also very well aware of the issue. The CVS representative had actually been the Board of Pharmacy Executive Officer in Ohio for several years, and he had thought that they had solved this problem. He had said that there was a resolution to where, at least on the CVS side, they updated their systems to allow a veterinarian's license number to be entered instead of that. And he said in Ohio, they did an outreach campaign and they rolled it out to, they said all of the CVSs throughout the country, but it appears it hasn't reached all the CVSs or all of the other chain drug stores either. But this is an opportunity for them to use the license number. They also said, though, that AVMA was also working on this issue, and that AVMA had met with them and told them, and they came to a resolution also to use the license number in lieu of the other 2 numbers. Then at the AAVSB meeting, Dr. Sullivan, he introduced us to an AVMA representative who confirmed that they had been working on this issue for quite some time, and they will be happy to disseminate information out to everybody involved. It really sounds like it's more an issue of education, that this is not something that should be required. It's not legally required to do so, and it's not in the best interest of the animal patients or the clients by requiring to do so. And so our next steps, we would like to still reach out and have meetings with Costco, Walgreens, Rite Aid, and GoodRx. So far, everybody that we've met with has agreed to partner with us in disseminating information. And so after we gather all the information from these prospective parties of what they see the education needs to be, then we'll reach out to DCA's Office of Public Affairs team and work to create an educational campaign that we can then launch to all of our licensees, to the Board of Pharmacy licensees, and then all of these other industries nationwide to hopefully provide more education on this issue. So this was merely just to let you guys know this is on our radar and this is what we're doing right now to try to address it. So Dr. Nunez, I don't know if you have any other things you wanted to add before getting other board member input.
Yeah, it's a complicated world that we are exploring. I told Jessica we should make a podcast of our weekly adventures. These discount programs that an individual pharmacy works with, every pharmacy works with a different discount program. And so even though it's CVS, one CVS to another might be working with a different discount program that has their own requirements on what needs to be logged in. And we're having a hard time finding who oversees all of them, if anybody. I definitely appreciate that I am not in the world of human medicine. I like our world of veterinary medicine. We don't have to deal with a lot of the complicated things that they do. But it seems like we can use our license number, but a lot of pharmacists don't know that. And so, as Jessica said, it's going to be a matter of educating them that, and they probably need to hear it from their board of pharmacy, not us screaming veterinarians on the phone saying, yes, you can use it. So that's our direction right now. And yeah, that was it. Any questions from the board about that? Any moderator can open it up for public comment.
Thank you, Mr. Board President. I am opening up the Q&A panel, and if any member of the public would like to comment on this agenda item, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions and we'll give you a moment. All right, Grant Miller would like to make a comment. So Grant, I will let you unmute yourself in a moment. Please remember you'll have 3 minutes. I'll give you a 30-second warning. And Grant, you should be able to unmute yourself and you are unmuted.
Thank you very much. We really appreciate the board reaching out to us and talking to us about this issue. Chances are, if it is an issue confronting the veterinary profession, the CVMA has tried to do something about it, or at least we know about it. So thank you very much for that collaboration. I'd also like to point out and just give you guys a real thumbs up here. This is an example of something the board can do to improve access to veterinary care. It's a huge example. And so just before we were talking about like, well, what could we do? What can the board do? This has gone miles. And Jessica and Mark, in a very short amount of time, have been able to break down more barriers in relation to the NPI number issue than we have done here at the CVMA in several years. And that represents the power of the board. We at the association just don't have that kind of foothold necessarily with a lot of these authorities that we would like to be able to access. And so I think that that is just a great example of something that you already are doing to improve access to care for millions of pets potentially. And in that vein, given the close proximity to Halloween and the striking resemblance of Jessica to Linda Carter, I vote that Jessica dress up as Wonder Woman for Halloween. Thank you.
I want to dress up as Wonder Woman, though.
All right. Oh.
Go ahead. Another public.
Oh, we have another request for comment from Anita Levy-Hudson.
All right.
Anita, you should be able to unmute yourself.
Thank you so much. Thank you so much, Jessica and Mark. Oh my goodness. I cannot tell you the amount of gratitude that would be pouring from every RBT out there that has had to deal with this situation. I know the doctors do too, but in my life and my experiences, it's been me or someone else, and we're trying to do that. At the same time, we have other tasks piling up, things that need to be handled with animal care, because, we're never staffed well enough to have one person doing this task. So I'm super excited about progress that has been made on this. I'm very excited that we're even looking at it because it's a small facet of our day, usually one thing, but it's one less annoyance. And if we could take care of that one less thing, it would just mean so much. And I know also to the pharmacy people as well. And I had a thought as you were going over it just now. Another thought that came to my mind is that I want to make sure that it's not just that people are necessarily seeking cheaper prices to go out and get it from an outside pharmacy, but we're required, I believe that the hospital is required to give handwritten prescriptions, and they have the clients have the choice on where they want to go. So this is definitely an impediment to them getting that medication, because they should be able to take it anywhere, especially if it's a human med, and get that prescription filled. I mean, I'm concerned about how that would, potentially violate some other regulation, but I don't know which one, obviously, at the moment. But overall, I just wanted to share my gratitude and say thank you so much, and I look forward to following this and seeing how it goes. And of course, if CARVDA can provide any additional support, then you just give us the word, and we're happy to do that.
Any other public comments?
No, that was the last. Would you like me to close the Q&A panel?
Yes, please.
Okay.
And you're absolutely correct. We are required to provide a handwritten prescription to any client which asks for it. The world of human medicine sometimes forgets about us, and when they make these rules and regulations. The last thing I would say, along the vein of this being a trip down the rabbit hole, the Board of Pharmacy president did give us a warning in January of 2022. All prescriptions in the human are to be electronically submitted to the pharmacies by e-prescription, which requires a special portal and so forth. But through CVMA's efforts, we've been exempt from that. But don't expect all pharmacists to know that we're exempt. So they may say that this needs to be submitted through e-prescriptions through their special portal, which not every veterinarian knows what that is. So that was the warning that he gave. But we'll deal with that if it becomes an issue. Any other questions from the board? Then moving on to agenda item 10. Update discussions and possible actions on legislation.
All right, so this is going to be fairly quick because I have a few things that are good news, some not so great news, but just updates. AB 1282 was signed by the governor and will be enacted January 1, 2022. So right now, we're working with DCA on what it's going to take for implementation-wise. There's going to be some system updates that we're going to have to do to start registering the blood banks. And so we are going to work on that way. We also have pursued a budget change proposal to get a limited term AGPA to help with all of the implementation requirements that go into this. It's in our fiscal impact analysis that we provided multiple times and already discussed, but just high level, we have to look at updating applications. We have to look at some regulations that we're going to have to put into place. We're going to have to set a potential fee for the registration that may include doing a fee audit. We'll also have to work with CDFA in partnership with them to help create some guidelines for the best practices. So there's quite a bit of work that we're going to have to work together on to try to create this new program and then launch and provide the oversight of the program. So that's we're starting those discussions right now, and we'll continue to provide updates as they're available. For AB 1535, that was our sunset bill, which the governor did also sign into law, so it'll become enacted January 1, 2022. For the most part, it does have everything that the board has asked for. The only thing that was not included in the bill was the telemedicine definitions that the board had approved in July. And so the board has a decision to make if they want to proceed with trying to get another piece of legislation to carry the bill. And we would hope to have that direction from the board right now because we would want to start looking for potential authors or vehicles for that definition. So I'll pause there in case you guys wanted to discuss that.
And when is our next sunset date?
We got 4 years, so it's going to be 2026.
Which is very good.
Yes, other boards were not so fortunate.
Yeah. I will say that in regards to the blood bank bill, that is going to cost quite a bit of funding to set up. And Jessica did an amazing job to ensure that the funding is done in a way that's never has been done before in funding some of our programs, so that it's not going to come out of licensee fees initially to set it up.
I have to point out though, it's not final. It's still that's still in the works. So I don't want to overpromise. That's something I've been pushing for. It's something in prior meetings with the governor's office, agency, Department of Finance, they were all on board with. But now we're at kind of where the rubber meets the road of whether or not that's going to be successful. So I'll keep providing it.
I won't jinx it, but we're very mindful of the funding for it. And like I said, if things have never been done that way before, that doesn't deter Jessica when she's on a mission. She finds a way to get it done. And I see lots of raised hands. Christina, Kathy, then Jamie.
Okay, thank you. Thanks for the hard work, Jessica. As usual, we really do appreciate what you're doing. I did want to I was looking at the timing for the blood bank bill, and it says that we have until March 1st, 2023, which seems like a long ways away, but I know that that comes around quickly. And I'm just wondering if we should be thinking about asking the MDC to look at, because I think that we will have some different regulations in terms of how to collect blood and what's appropriate sedation and the various things for the veterinarians and how they're collecting blood in these community banks. And I just wondered if we wanted to maybe start the work on how that should look sooner rather than later. So I just wanted to put that out there.
Yeah, and I think that's also part of the work of in the bill, the CDFA coming out with the guidance and that we do it. So I think it'd be a fantastic idea to go ahead and give that to the MDC now to start working on, and then that whatever subcommittee comes out of the MDC would hopefully also participate in the CDFA discussions as well.
Can I just say, I think Dr. Payton would be a great resource there, since she's highly trained in blood, all things blood. So.
Kathy?
Thank you. Agree. I think that's a great idea to have MDC look at that. I think you already said that. I just want to confirm, Jessica, since we had a 10-day calendar day deadline, we already submitted the BCP request.
We did, and it's currently with agency. They actually emailed me questions this morning, and I've been responding in between the breaks. So we are.
Okay, perfect. I noticed the governor signed it, I know he signed it about the 9th or 10th. I just also wanted to say that I think this evolution of this particular piece of legislation has been a number of years in the making, as we know, and it's gone through a lot of different permutations. But I think our involvement and our suggestions on amendments were really helpful. I think everybody's this collaborative process was helpful to make a better, more thoughtful piece of legislation on a situation that is so critical. And so, sort of a very complex situation about blood production and distribution and quality and quantity in California. So I think all of our requested amendments, the annual license date, et cetera, were accepted. And I just think it was a good product that the board worked on, and Jessica and your staff really worked a lot on. So, and CVMA, it was a really good collaborative effort. And now we move forward. On the second one that I had, I mean, I'm happy. Ultimately, you're leaving it open on the bill. If and when you want a motion to have the board pursue a legislative vehicle for the telemedicine definitions, telehealth definitions, I'm happy to make that motion. I don't know if it's in order right now or not. So.
I don't know if we're ready to make that motion just yet. So we'll put a pin in that. Any other questions from the board? And do you want to finish your legislative report before we open up to the public, or do you want to hear the public now?
Sure, we can go ahead and then maybe take a motion after that for that agenda item. But I mean, the other two are brief because neither one of them were successful this year. Homeless shelter grants, that's the one that the board did support. Unfortunately, it did not pass. We think that it's primarily because of the cost that was associated with it. SB 731 also was unsuccessful in passing. So neither one of those made it to the governor's desk, and we do anticipate them coming back in some way, shape, or form next session.
Okay. So do we need to take any actions on any of these other than what Kathy had just said about pursuing?
So you could take do what Dr. Bradbury has suggested and request that the MDC start looking into the blood banks and the best practices. And you could also do a motion on the telemedicine definition.
Okay. We'll entertain a motion and then we'll open it up to the public for any of those actions. Dr. Bradway, do you want to clarify your recommendations for the blood banks best practice?
Sure. I would like to ask the MDC to begin investigating best practices for community blood bank blood collection as it relates to veterinarians.
I'll second.
Any further comment from the board? Moderator?
Thank you. I am opening up the Q&A, and if any member of the public would like to make a comment on this agenda item, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions and we'll give you a moment. All right, I see no request for comment. Mr. Board President, shall I close the Q&A panel?
Yes, please.
Okay.
Any further comments from the board? Call for the vote.
Ms. Bullard?
Aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Ms. Prado?
Yes.
Dr. Solocito?
Yes.
Dr. Nolan?
Yes.
Dr. Nunez?
Yes.
Motion carried.
And do I hear a motion for the second recommendation?
Yeah, it's Kathy. I can do that again. And I would say that the other thing, it's not surprising that this language couldn't get swept into the sunset bill. Our timing when we approved these in late July, that bill was already, sort of that horse was out of that barn. So I'm not surprised about that, but therefore I would like to make a motion that the board staff work to pursue legislation next session would include these new definitions that we adopted in July on telehealth.
I'll second that.
I'm sorry, was that Dr. Bradbury who seconded?
It was. I'm sorry. I have my camera off.
That's okay. Thank you.
Okay, we have a motion and a second to direct staff to do what they do, to come up with legislations for the language that was put forward for telemedicine definitions. Any further discussion from the board? And hearing none, moderator.
Thank you. I am opening up the Q&A panel, and if any member of the public would like to comment on this agenda item, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions, and we'll give you a moment. All right, I see no request for comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay.
Any further discussion from the board? Please call for the vote.
Ms. Fuller,
Aye.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Ms. Prado,
Yes.
Dr. Solocito,
Yes.
Dr. Noland,
Yes.
Dr. Nunez.
Yes.
Motion carries. Thank you.
And is that it for the legislative report? I believe so.
Yes.
Any further questions from the board? All right. Can we move on to the next item? Do I have to open up one more time for the public on? Okay. Agenda item 11, update discussion and possible action on proposed regulations.
Good afternoon.
Let's see what kind of a table you have prepared for us this time. I hope it's colorful and entertaining.
Right. It will be. Good afternoon, board members. Justin Sotelo here, providing you a status update on our pending regulations. If I could, moderator, actually be able to share my screen, that would be great.
Sure. Hold on, Justin. Okay, you've just been made the presenter, so you can share your screen.
Okay, thank you. Okay. So I have the memo up here. As noted here, the board currently has 16 rulemaking packages. 5 of those are in the final phase of the review process. Of those 5, 2 of them are Section 100 rulemaking packages, which I'll discuss here shortly. Outside of those 5, we have a remaining 11 packages that are in our queue. 3 of which are essentially on hold until other legislative or regulatory changes take effect. So this memo provides an update on 7 packages. So I'll just go over those here briefly. The first item is the animal physical rehabilitation package. And as noted, this will be discussed in more detail under agenda item 9D. Under that item, the board will be asked to provide final approval of the regulatory language. And then just a quick update, the package was submitted to the Office of Administrative Law on June 9th. It has been pending review. It was made known that we would have to bring it back to the board to get your final approval due to comments we received during the 15-day comment period. And there was also an additional non-substantive change that we did to the language as a result of OAL's questions for us, and I'll go over that in more detail when we get to that item. So again,
Agenda item 11, it's 11D, not 90. I think you said 90.
I'm sorry. Thank you for the correction. 11D. So we'll go over that in just a moment. Move on to the next item. Drug compounding, another item that will be addressed on this agenda. That is item 11E. There, the board will be asked for approval of proposed responses to comments received during the second 15-day public comment period. As you may recall, at the last meeting in July, the board approved additional modifications to the language in response to some issues raised by DCA's Legal Affairs Division. We noticed those changes on July 28th. The public comment period closed on August 12th. And we did receive 2 comments during that comment period. These are not resulting in any further revisions to the language, but we do need the board's approval of our responses to those comments in order to include in the final statement of reasons for that package. Once we get your approval on that, we will go forward with submitting the final package to OAL. We do have a deadline of November 15th, although we're shooting for Friday, November 12th. So that is where we're at with that item, that package. Disciplinary guidelines, again, another item that we'll discuss under 11B. Under that item, the board will be asked to approve third modified text and to direct staff and the executive officer to complete the rulemaking process. With this package, again, the board approved modifications on July 22nd. We went forward with the public comment period on July 28th. I'm sorry, July 28th, that was correct. Closed on August 12th. We did not receive any comments during that public comment period. However, during the final review, DCA's final review, there was an issue raised by the DCA Director's Office. So we consulted with our regulatory counsel, Karen Halbo, board counsel, Tara Welch, and we drafted some additional revisions for that package for the text in the disciplinary guidelines. So again, you'll see that under agenda item 11B. Once we get your approval on that item, if approved as is, the plan is to actually have the documents available on the website today. We'll start the public comment period, the final, third public comment, 15-day public comment period today, which will conclude on November 5th. And again, we're up against the deadline, our submission deadline to get this to OAL. So the plan is to get it to them, the final package, before Friday, November 12th. Okay. And feel free to stop me at any point if there are any specific questions about any of these packages. Uniform standards for substance abusing licensees. Again, a package you will be seeing today under agenda item 11C. Originally, the proposal was approved by the board in October of 2019. It is in our queue to be processed and put forward. However, just recently, Jessica and Tara found that the proposal required some additional revisions, and it's basically just aligning the uniform standards language with the regulatory language and with the language in our disciplinary guidelines. So Jessica will go over that in more detail under 11C.
One thing, just to jump in, actually, that was the original plan. After we had posted this, so we received some feedback from the regulations unit in DCA, and I think that there's a number of questions still that need to be addressed, and so we did not have enough time to review the questions. I don't think I've actually received the questions yet, but I think that there was not adequate enough time to look at the questions and bring them to the board's attention by the time that I found out that there were some more issues. So we're going to table it until the next meeting.
Gotcha. Okay. Thank you. The next three items listed here are all Section 100 changes. These are changes without regulatory effect. They're non-substantive, and they don't require that we go through the standard rulemaking process. This one listed here, limited term RBT eligibility window. It's essentially repealing outdated language that pertain to the RBT State Board exam. And I would like to take a moment to thank Mariko Kotani. She is an attorney in the LAD Legal Affairs Division. She assisted us with these two packages, this one here and the next one here, sodium pentobarbital. And I'll thank Karen Halbo for facilitating that. Apparently she has done quite a few of these Section 100 changes recently, and she was available to just jump on them and get them done, prepared. And we had both of these submitted on September 21st. OAL has 30 working days to review them. That would put us at November 3rd. To date, I haven't received any comments or questions on these, so hopefully no news is good news, and hopefully I will be able to report next meeting that both of these were approved. So that's those two. The last one here, Bcpr Telemedicine. This is the regulatory proposal, the Section 100 proposal related to the legislative proposal that you just discussed that would put the electronic veterinary services definitions in statutes. So that's the teleconsultation, telehealth, telemedicine, teletriage. But as we discussed, we'll be pursuing that in the upcoming legislative session. So those changes will have to take effect until we can go forward with this Section 100 proposal. So those are the 7 updates, and as always, we provide the colorful spreadsheet here for your review and for additional updates. Again, anything in red is an update or status change since the last meeting. So with that, are there any questions or comments regarding the regulations update?
If only we can do a Section 100 regulatory proposal to solve global warming, that would be good. But again, we're going to be talking about some specific regulations on their own. But any questions about the overall big regulatory chart for Justin from the board? Kathy?
Hi, yeah, and it just occurred to me, just because it seemed like we've been working on this uniform standards for a long time. When is the drop dead? When do we come against the wall on that one? Obviously, we have some time, I guess, because we still have these new questions to deal with that they proposed. But is that coming up as well at the early part of 2022?
So there's no deadline yet because we haven't submitted it at all. So we're not up against that deadline. However, this is something that we need to address sooner than later. It has been essentially the requirement for the Healing Arts Board for, I think, over a decade now. So we're a little late to the game here, but it's definitely a priority of ours to move it forward as soon as we can. But I only have one Justin, and he is working his hardest to get all of this stuff through.
And that is agenda item 11C.
Yeah, and I would say that is definitely the next one in the queue. We've got these 5 that are, well, the 3 that we're going to discuss here in just a moment. But hopefully once those are submitted to OAL and final, I'll be able to shift gears and then focus on the next packages in our queue.
Okay.
I just wanted to also add that I know it looks daunting because this list is so large and it takes so much time, but I am confident that after we get through these older packages, the newer ones that the board has created should be a lot more streamlined. There's a lot more documentation that happened during the process when it was brought to the board that we can access, and the issues are a lot more straightforward. So I think once we get over this hump of these more complex packages, I think it will be a lot easier to move forward.
They're like the plug at the end of the water pipe. Once you get them out, the rest are going to just flow out. Okay, so are there any comments from the public on any of the items that are not, that we will not, that's not B, C, D, or E? Moderator?
All right, let me go ahead and change my co-presenter back to the main presenter so he can display the instructions, and I will open up the Q&A. If any member of the public wants to make a comment on this agenda item, please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions and we'll give you a moment. All right, Anita Levy-Hudson would like to make a comment. So Anita, you've been given permission to unmute yourself.
Great, thank you so much. I am wanting to comment on some of the pending regulation. There's one that I can't remember the exact title. I'm trying to click on the link, but it's one that's been there since about 2014. I know that there is this big bottleneck, and I know there's tons of things, but I was just wondering if this was some of what you were referring to just now, as far as the older regulations that we're trying to get done. The one on RBT education.
Yeah, I think uniform standards and RVT education are, I mean, unless Jessica says otherwise, are at the top of my list.
Awesome.
At this point.
Great, thank you. I appreciate that.
Yeah, absolutely.
Yeah, I mean, looking at all these other regulations, they all are important, of course. But Justin told me offline that they'll all be done by the next meeting.
And this is the moderator. We have Kristen Hagler is asking, is now the time to comment about animal rehab?
Not yet.
Not yet. Okay. All right. So with that in mind, then we are done with public comment. Shall I
Okay.
close?
Yes, please. And if there's no further comments from the board, we will move on to agenda item 11B regarding disciplinary guidelines.
Okay, and that's me again. And moderator, if I could be able to share my screen again, that would be great.
Sure. Hold on just a moment. All right, you're good to go.
Okay. Hold on one moment. Let me just get to the page that I need to be on.
So there's going to be a modified text that's going to be presented, and we need to vote on it.
That is correct. And
it is the third modified text.
It is the third. The more detailed history is provided in the memo. I'm just going to kind of jump ahead. As I mentioned, the board approved a second modified text in July. We noticed that for 15 days, that public comment period closed on August 12th. We then submitted the final package to DCA for final review. However, as I mentioned earlier, there was a concern or issue raised when the package was being reviewed by the DCA Director's Office. So I'll just kind of go over what happened here. It was submitted to DCA on August 20th. On September 23rd, board staff was notified that the DCA director had a concern regarding proposed modification. Sorry, I'm trying to see my screen here. Modifications to standard term number 10, tolling and probation. More specifically, there was a concern about the automatic cancellation of a license without a hearing for the probation violation of non-practice in California for 2 years. The issue was raised due to a case involving the Medical Board of California, in which the court held that automatic cancellation of a license without a hearing is not a reasonable condition of probation. To address the DCA director's concerns, board staff consulted with board counsel and regulatory counsel to draft third modified text of the disciplinary guidelines that's provided as attachment 1. And the change occurs on page 16, and I'll scroll to that here in just a moment. Regulatory counsel recommended revising the language to make the 2-year non-practice condition a violation of probation. If that condition is violated, the executive officer could enforce the terms and conditions of probation by filing a petition to revoke probation, which would afford the probationer due process in a hearing. In addition, if the board approves the third modified text, the proposed regulations would update the date of the disciplinary guidelines to October 2021. And as I noted, if the board votes on this today and approves the language as is, it will be noticed beginning today. We'll send out a notification to interested parties that we have a third 15-day public comment period, which would close on November 5th. So, and then the action requested is here, but do you want me to jump over to the revision, Dr. Nunez? I think you're muted. Sorry.
Going to what is proposed currently?
Yeah, let me.
Yeah.
I'll just give me one moment.
And sorry.
Okay. So I know we have another colorful document here, but the third modified text is shown with italicized, double underline, or italicized double strike through. So it occurs on this paragraph here that would have read, respondent's license shall be canceled. That is being struck. I don't know if it's easier for you to just review it or if you want me to read it out loud. Open to suggestions.
What page was that?
It's on page 16.
Okay.
It's under tolling of probation, item 10.
So a licensee is on probation, and they're also tolling that probation, and they can toll in another state. And if they're in another state, they're not practicing in California. And if there's a violation of probation, there needs to be a hearing before the license is, or the terms of probation is activated and the license is revoked. Is that it in a
Yeah.
nutshell?
So just to clarify, the whole purpose of being able to cancel a license is so that the probationer wouldn't be indefinitely tolling. Because right now we have 10 probationers who are going to toll essentially indefinitely. There's still some conditions though that aren't told, so it still requires some monitoring by the staff. For someone who is never planning on coming back to California. And so we wanted a mechanism in order to remove that from the monitoring. And so the recommendation before you is essentially saying, okay, if you toll for this long, it's considered a violation of probation, and then we would file the petition to revoke probation based on the fact that they have been tolled for over 2 years.
I see. And the office wasn't in agreement with that proposal.
They wanted in agreement with the automatic cancellation. And primarily because of the director's experience with, they had the same language and it was challenged in court and they were unsuccessful. And so she's sharing that knowledge with us so we can learn from that lesson.
But it's more due process for the probation.
Right.
So it's going to potentially cost us money to clean up these indefinite tollers. What's the benefit of it? Is it worth it?
Well, just to clarify, this is not retroactive. So the 10 that are tolling, they are left with those conditions. What this does, though, is in the future, if they have this language, then we're able to file the petition to revoke so they are not indefinitely tolling. With the having to still file the petition to revoke the license will still cause more resources and more money than if we were able to automatically cancel. But it's something that I think we should still proceed with because it would, in the long run, cost less resources to continuously monitor probation for someone who's tolling for after 2 years.
Got it. Okay. And if we pass this, there won't be a fourth modified text, right?
Please don't jinx us.
Any questions from the board on the third modified text? All right, there's Kathy.
I was just gonna, if there are, after the questions have finished, I'm happy to make the motion.
Well, we can make a motion and then open it up to the public on the motion. So do you make that motion, Kathy?
Sure, I think. Here it is. I'd like to move that the board approve the third modified text to amend CCR Title 16, Section 2006, and the Veterinary Medical Board disciplinary guidelines therein incorporated by reference, and direct staff to take all necessary steps to complete the rulemaking process, including preparing the third modified text for an additional 15-day comment period. And if there are no adverse comments received during that 15-day comment period, delegate to the executive officer the authority to make any technical or non-substantive changes to the proposed regulations that may be required in completing the rulemaking file and adopt the proposed regulatory changes.
Oh,
And I'm happy to second that, Mark.
did you write that yourself, Kathy? That was very nice.
I memorized it.
It was
Yeah.
very nice.
Yeah.
All right. It's been motioned and second. I assume your hand is now down, Kathy, and we'll open it up for public comment, please.
All right. This is the moderator. I'm opening up the Q&A panel. And if any member of the public would like to comment on this agenda item, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. And we will get instructions up in just a moment. I need to give my co-moderator the presenter role back. So here we go. All right. So if any member of the public would like to comment, please type that you would like to make a comment. And just double checking, this is still not the time to talk about animal rehab, correct?
Not yet. It's coming.
Okay. Okay. Thank you. In that case, again, we have no public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay.
Christina, Dr. Bradbury.
This is not substantive, but I noticed that it shall be considered a violation of probation is not double underlined, and I just thought we probably wanted to have it consistent.
Any further comments from the board? On January 20th, 2022, it will be the seven-year anniversary when this was originally proposed. Let's call for the vote, please.
Ms. Bowler.
Aye.
Dr. Bradbury.
Yes.
Ms. Laredo.
Yes.
Ms. Prado,
Yes.
Dr. Solocito,
Yes.
Dr. Noland,
Yes.
Dr. Nunez.
Yes.
Motion carries.
Agenda item C, Jessica had proposed not to discuss that at this time because there just needs to be more research done. So we will table that. And now it is time for the regulation on physical therapy. Agenda item 11D, physical rehabilitation.
Okay, thank you. And I will be presenting this item as well. There's a long history here that's provided in the memo and linked to, but I'm going to jump ahead a little bit and just note that the final rulemaking package was approved by DCA on April 17th. It was approved by agency on May 13th. On June 9th, as I indicated, the final rulemaking package was submitted to the Office of Administrative Law for final review. Normally, OAL would have 30 working days to review the file. However, they are currently utilizing the extensions provided by the governor's office, giving them a total of 120 days. And as I mentioned, we also need a vote from the board today in order to conclude this package or conclude OAL's review of the package. Right after the July board meeting, we received some questions from OAL regarding a few of the provisions in the proposed language. After consulting with board counsel, the board's responses satisfied OAL's questions, but resulted in one minor non-substantive revision to the language to clarify the veterinarian supervision under which an RVT may perform APR. I'll show you that exact revision right here. So specifically, OAL recommended the following non-substantive revision to the language to clarify the two types of supervision, direct and indirect, which otherwise are defined under CCR section 2034, subsections E and F. So you see right here how the language will read if approved by OAL. It's adding the words direct or indirect before the word supervision and striking the to be right before determined. So that is the non-substantive revision that OAL is recommending. And then, as I mentioned, because additional adverse comments were received during the 15-day public comment period back in October of last year, and because these non-substantive revisions recommended by OAL are being recommended, the board must approve the final proposed regulatory language, which includes the modified text and the non-substantive revision noted above, in order for OAL to conclude their review of the rulemaking file. The final proposed regulatory language is provided in the attached order of adoption. And we've provided the action that is being requested by the board today. So if there are any questions, please let me know.
So on page 3, we have the final language of these regulations. It says order of adoption on top, animal physical rehabilitation. This has the non-substantive changes, and we've responded to public comments on the modified text. And there is language to be read if we desire to adopt this language, this regulation.
That is correct, yes.
All right.
Under the action requested.
I would like to motion to approve the final proposed regulatory language to add section 2038 2.5 to Article 4 of Division 20 of Title 16 of the CCR, directs staff to take all steps necessary to complete the rulemaking process and delegate the executive officer the authority to make any technical or non-substantive changes to the proposed regulations that may be required in completing the rulemaking and adopt the proposed regulatory changes.
You read that very well. Is there a second?
I'll second. Kathy.
It's been motion and second. Is there any further discussion from the board? All right, so now, moderator, we're going to open up for public comments on the regulation regarding animal physical rehabilitation.
All right, thank you. I've opened up the Q&A panel, and if any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen. And once again, I need to give my co-moderator the control so he can show our instructions. And we've got a comment from Adrian. So Adrian, I'll let you know when you can unmute yourself. All right, Adrian, you should be able to unmute yourself. You'll have 3 minutes.
Thank you. So I am the manager of a facility where we practice animal physical rehabilitation, and it is supervised directly by veterinarians. And I am in support of the language because I've personally seen multiple situations where if there was not a veterinarian on site, it could quite possibly and likely result in the loss of life of a pet multiple times. And secondly, you know, medication management is a huge part of rehab with pets in the state. And to force a consumer to go to multiple facilities in order to get their medication management and their physical therapy, I feel is a disservice, and it's also an unnecessary financial burden. When if there's a vet supervising, that can all be taken care of in the same appointment. And that is my comment.
All right, our next comment is from Jessica, and Jessica, I'll let you know when you can unmute yourself. So Jessica, you should be able to unmute yourself. All right, we're gonna go, Jessica, we'll come back to you. We'll go to Christian Hagler in the meantime. Oh, it looks like you're unmuted now, Jessica.
I'm sorry, did you say you could hear me?
Yes, yes. You're a little choppy, but we can hear you.
Thank you so much. Okay, thank you. So my name is Jessica Waldman. I'm a rehab veterinarian. I've been practicing only animal physical rehabilitation in California for 15 years. I served on the initial task force on this topic 15 years ago, as well as the secondary task force. So I've been an active listener and participant in all the topics related to this. I wanted to most importantly, advocate for the pets. That's my job as a veterinarian. That's the oath I took many years ago. I have personally diagnosed seizures, infections, bleeding tumors in the abdomen, and had to deal with those situations right there and then during animal physical therapy. Why? Because the pets we see are not stable. They are post-operative pets that have infections. They are geriatric pets that have endocrine disease and heart failure. As a veterinarian, it's expected that we look at these little tiny subtle signs on the physical exam to know when a pet is in danger, when a regular person, as much as they care about pets, aren't able to do this. So I think most importantly, I'd say for the pets, if we want to protect the consumers, let's protect the pets. My next comment on the topic is in terms of access. There's over 120 people, whether it's veterinary technicians or physical therapists or veterinarians in the state of California, certified in animal rehabilitation. That is actually more access than there are veterinary ophthalmologists in the state of California. So in terms of access, there's at least double the amount of veterinary ophthalmologists, yet we don't hear human ophthalmologists calling and saying that they want to practice on pets without the education to do so. I support the language. I'm very thankful for the board. I'm very thankful for the consumers in the state of California who believe in protecting their pets as the most important thing.
All right, our next comment is from Kristen Hagler. And Kristen, I'll let you know when you can unmute yourself. Okay, Kristen, you should be able to unmute yourself. There you go. And Kristen, you're unmuted.
I'm one of two veterinary technicians specializing in rehabilitation in California, a veterinary technician specialist. I have participated on the Animal Rehabilitation Task Force for this agenda item and very familiar with the previously suggested models for the inclusion of the human physical therapist in the practice stack. I support the inclusion of supervision levels for the physical therapist in the practice act and include direct supervision by a California licensed veterinarian to maintain the consumer, pet, and team member safety. I have also suggested for the RVT to be on the premises as well when an animal rehabilitation is performed. This is also a position of the California of Registered Veterinary Technicians, which was submitted April 23rd, 2020 to the Veterinary Medical Board. And this is the same sentiment with many other rehabilitation providers. This model helps to solve consumer accessibility issues to veterinary medicine in rehabilitation, maintains that VCPR with a veterinarian who's familiar with the condition, solves those animal emergency concerns should they occur, stops the infringement on certain RVT designated job tasks defined in the Practice Act, and supports consumer and pet safety. Physical rehabilitation is a prescription, and a veterinarian is the only legally acceptable provider to write such a prescription for animals. And with over 100 combined certifications for rehabilitation veterinarians, technicians, and physical therapists alone, the consumer continues to have many options for rehabilitation services compared to other specialties with smaller numbers. With a veterinarian accessible on the rehabilitation team, immediate access to pain management solutions are available should the need arise, and they arise nearly daily in rehabilitation. We have previously brought this to the attention of the Veterinary Medical Board, these concerns, but from several colleagues from across California and the United States. The supervision model, including direct supervision of the physical therapist by a veterinarian, and also, as I said, support the registered veterinary technician being on the premises, has become increasingly more important during COVID-19. Referring a pet back to a primary care provider for medications or diagnostics often results in delayed care because veterinary practices are overwhelmed. Pets are often unable to be seen for weeks at a time, and with immediate access to a veterinarian, the technician and physical therapist can facilitate that veterinarian adjusting the pet's prescription plan and address the consumer needs in that moment instead of potentially delaying the care that the pet needs if a medical clearance model be adopted. I support the proposed regulations as written, and I thank you everyone for your efforts and time. This has been a long process. Thank you.
All right, and this is moderator. That was the last public comment. Oh, we've got one more. That's Karen Atlas would like to make a comment. So Karen, I will give you permission to unmute yourself. Okay, you should be able to unmute yourself.
Thank you very much. Thanks for allowing a comment relating to the decision that this board will make regarding the animal physical rehabilitation regulatory language that is before you today. My name is Karen Atlas, and I am the president of the Animal Physical Therapy Coalition. Just so we don't conflate different physical therapy associations, I'd like to emphasize and remind this board that we are a coalition who represents DVMs, PTs, RBTs, and consumers who are all like-minded in our approach to increase safe access to properly trained and licensed physical therapists, so more animals can get the care they need, and so licensed professionals, both PTs and DVMs, can work more collaboratively in the best interest of our shared patient populations. The regulations before the board today once again fails to meet the stated objective and, if enacted, will directly be responsible for one of two very undesirable outcomes. They will either number one, unnecessarily close the doors of legitimately practicing physical rehab clinics today, or number two, unnecessarily cause a huge increased cost for services by taking away the indirect veterinary supervision option for outpatient clinics providing these services. Both outcomes would be a huge disservice to the consumers and animals of California. There is, however, good news to all this, and that good news is that the issues are not insurmountable. There are workable solutions. We ask that you please put a hold on the current regulatory language that is before you today. By simply waiting to enact the regulation, you will be making the active decision to allow consumers greater access to care temporarily during this COVID-19 crisis. As previously pointed out, the board has opined, and we agree, that legislation is the remedy. Once legislation is enacted to improve access to properly qualified and licensed PTs to work under the direct or indirect supervision of a veterinarian, then the regulatory language that you have crafted here would be much more suitable. But if enacted now without a proper legislative remedy, you will be worsening the lives of many animals and the people who love them. Other states have solved this issue through swift changes in legislation, and it has worked well to improve the access to care and allow licensed professionals to better collaborate. In 2018, a legislative bill, AB 3013, would have done a very nice job in alleviating this problem, but the VMB opposed it, and unfortunately they based their opposition largely on misinformation that they were given. Over the past decade, we have provided factual information for the board to consider. In the document sent to the board members and staff ahead of this meeting, we shared some letters from DVMs who have identified that their own association, the CVMA, has not been upfront and honest with their membership as it relates to this continued physical rehab conundrum. We urge you to put these regulations on hold temporarily, and we hope to work collaboratively on a proper legislative remedy. And just to touch on the about the medication adjustments. In my practice, I've noted that the referring veterinarians from other clinics don't actually want us to be adjusting medications with our on-site veterinarians. They want to stay and maintain control of that so that.
And this is the moderator. That was 3 minutes up. We have no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay.
Any further comments from the board in regards to the proposed regulations, modified text? Hearing none, we can call for a vote.
Ms. Bullard?
Aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Ms. Prado?
Yes.
Dr. Solocito?
Yes.
Dr. Nolan?
Yes.
Dr. Nunez?
Abstain.
Motion carries.
Next one is agenda item 11E, drug compounding.
And I believe Karen Halbo was going to present this item. Is that correct, Karen?
Sure, Justin.
Thank you.
There's a memo the board got about this regulation, the drug compounding regulations. We got comments on the modified text, and the memo summarizes the different comments made and gives recommended responses. each comment, I guess I've numbered the different sections where, so there's 2, 3, 4. Hopefully, I don't want to read them to you. You've had this material. Are there any questions about the comments and the proposed responses explaining why the board is choosing not to make changes based on these comments?
I don't see any raised hands. I think that may or may not be because they understand what's being proposed.
Okay. Well, I can summarize. I can do a quick
Yes.
summary of these, and I'm happy to do that if that's
Yes,
necessary.
please. Yes, just a quick explanation because
Okay.
it is complicated.
It is. It is. Okay. So on the drug compounding regulations and the changes that we made, and the changes needed to be, the comments could only be directed at the changes. And the comment said there weren't clear standards for compounding veterinary drugs, so wait until the FDA or the US Pharmacopoeia issues standards. And the regulations, veterinarians have been doing compounding for years, and there has been no regulations to help or clarify. And from the Multidisciplinary Advisory Committee recommendation about this was that we needed to have regulations with the authority that we have right now and the rules that we have right now. So we wanted to give veterinarians some basic guidelines and clear that it's okay for them to do compounding as they have been doing. We don't have the USP veterinary drug compounding guidelines. There's discussions of that happening, but it doesn't exist yet. And waiting for that leaves veterinarians without clear understanding that they can do basic compounding. There's a drug, we have the drug compounding statute, which is BCP 4826.5, and allows a vet or a supervised RBT to compound the drugs. And they do it consistent with current veterinary practice in the state. There may be continued evolution of drug compounding, but at this point, to promulgate these regulations will don't let the perfect get in the way of the good, and be able to have some regulations indicating veterinarians can do this drug compounding. It's not required. It is only for veterinarians that choose to do so, and veterinarians will attend and do attend different education, continuing education, in order to feel confident that they can do it. And the standard is they need to perform to the, competence with what they're doing before they undertake it. So waiting, the suggestion that we should simply wait for more direction from either USP or FDA gets in the way of providing regulations letting veterinarians know they can, if they are capable of doing it to a reasonable standard, they can go ahead and compound drugs for animal use. The next concern was that the board should get monographs and published standards for compounding the different drugs. And that suggestion was not about a part of the text that had been revised, and therefore the comment was outside of what the board needed to respond to. And there's been a lot of discussion about drug compounding, and at no point did the committees who worked on these suggest that we have California Vet Med Board monographs to follow. So for the third one, they suggested doing beyond use dates. And what we have in the regulations is using the term expiration date, because that both is able to be done with common veterinary software, and it's a common usage that people understand. What we did with the modification was to eliminate a subsection that would have allowed an expiration date to be extended under certain circumstances. And the board felt that that was not useful to switch the language to the recommendation of beyond use dates, and wanted to stay with removing the portion of the text that had been removed that had allowed for compounded preparations to be extended beyond expiration dates. That's for number 3.
So
And then-
it's gonna stay expiration date.
Yes,
Okay,
yeah.
got it.
And then another part of the comment was saying that the board should work with USP or FDA or the AVMA to have monographs for compounding drugs. And changes were made in the second modified text saying that if it's discovered in doing a compounding that there's been an error, that the client would have to be notified immediately. The previous language had said as soon as possible. And upon discussion, a veterinarian who's done a compounding and realizes there's a problem deals with it immediately. So as soon as possible was not accurately describing how it's handled. And then there was a change to subsection D in section 2095 to take out language relating to making peer review documents exempt from discovery. And that's because the board's power to regulate cannot affect the evidentiary code, and the issue of peer review documents being exempt from discovery is reaching into the evidence code and saying we're going to protect these documents, and that's beyond what the board's power is. The recommendation that was made, this 4th one, doesn't really address the changes, but we did discuss in the response what the board did and why the board did it, so that there's no question that we've addressed this, the suggestion or comment that was made that was actually outside of the scope of the second modified text.
Okay.
The comment letters were submitted with the meeting materials for your review. And so at this time, the board's being asked to consider a motion to approve the proposed responses and then direct staff to move forward with the rulemaking process. And it's another long but important words in the motion that if you wish to move forward and complete this rulemaking, I would ask whoever makes the motion to read all of it.
Okay. Pharmacology was my least favorite subject in veterinary school. And I think Jessica has her hand up, followed by Kathy, please.
Thank you. I just really wanted to throw this out there that Dr. Sullivan, Dr. Miller, and Dr. Howard were really instrumental in helping us draft these proposed responses. Drug compounding is very, very complex, and we wanted to make sure that we provided the best possible responses to enable these packages to move forward, but also to make sure that we're not making it any more difficult for the veterinarians to be able to provide these services. So they've been really instrumental. As soon as we got comments, or whether it was from the public or from OAL, they've been very quick to do a lot of back and forth emails. They've had discussions amongst themselves, and they've also had some pretty quick impromptu meetings with me and with Karen Halbo and Tara and Justin, just to make sure that we are properly responding to all of these. So I just really wanted to thank them for their assistance in this package.
Kathy?
It's funny, I was going to compliment the staff on these clearly written responses, but now I'll compliment also Dr. Sullivan, Dr. Howard et al. Because as a layperson, I thought they were respectful responses, but very clear, and it made sense to me. So anyway, and then at the given time, I'm happy to make, I assume we make a motion first to approve the responses and do the vote on that before a motion to the compact, move the rulemaking, correct?
I believe that's correct. Yes.
So if that's okay, I'll make the motion to approve the proposed responses to the written comments received during the 15-day public comment period on the second modified text and direct staff to incorporate those responses into the FSR when proceeding with the final rulemaking package.
Very good. Do I have a second? Do I have a second?
I can second that, Mark.
All right. Any further discussion from the board? Moderator, please open for public comment.
Thank you, Mr. Board President. I have opened up the Q&A panel and I will present or give my co-moderator control so he can show the instructions. All right, if any member of the public would like to comment on this agenda item, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists via our displaying instructions, and we'll give you a moment. All right, I'm seeing no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
And call for the vote.
Ms. Bowler,
Aye.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Ms. Prado,
Yes.
Dr. Solocito,
Yes.
Dr. Nolan,
Yes.
Dr. Nunez.
Yes.
Motion carries.
And Justin, have you ever seen a fourth modified text come before a board? Has that ever happened?
I haven't seen it personally, but I did find out yesterday that I think the DCA record is 9 modifications.
Wow.
That is not a record that we would like to break.
There is another motion that needs to be made. If anyone would like to practice their reading, it's on page 5, right above where it's right at the second paragraph of action requested.
Okay, I'm gonna go for it. I'll stop my video though. Okay, I would like to make a motion to direct staff to take all steps necessary to complete the drug compounding rulemaking process and delegate to the executive officer the authority to make any technical or non-substantive changes to the rulemaking package and adopt the second modified text to add sections 2090, 2091, 2092, 2093, 2094, and 2095 of Article 11 to Division 20 of Title 16 of the California Code of Regulations.
Very well done. Do I have a second?
I'll second the motion.
Been motioned and seconded. Any further comments from the board? Members of the public, please.
All right, I am opening up the Q&A panel, and if any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are giving you a moment. All right, I see no requests for comment. Mr. Board President, shall I close the Q&A panel?
Yes, please.
Okay.
And if there's no further comments from the board, we can call for the vote.
Ms. Bowler,
Aye.
Dr. Bradbury,
Yes.
Ms. Laredo,
Yes.
Ms. Prado,
Yes.
Dr. Solocito,
Yes.
Dr. Nolan,
Yes.
Dr. Nunez.
Yes.
Motion carries.
All right, the last agenda items for the day are all reports, and we've been going at it for a little bit now, so let's take a quick break for 10 minutes and we will finish up the agenda. The next item on the agenda is agenda item 12, Board President Report. That is me. The life of the president of a virtual board is lots of Zoom meetings, of course. It's been very helpful to have the weekly meetings with Jessica to stay on top of things, and executive meetings with Kathy joining us has really kept this board efficient and current and on top of all of the issues that we face. But some things that were a little bit out of the norm. Jessica and I had an opportunity to individually welcome our newest board members, the student representatives from UC Davis and Western, just to give them a broad overview of the board, how it works, and we're looking forward to their presentation later on today. And the Veterinary Medical Board went on the road, actually. We went to Denver and represented California. Well, I'll talk more about that when we get down to the National Association involvement reports. But I would probably like to follow in the footsteps of Christy and give some words, as this is my final report and meeting, not only as board president, but actually as board member. I've served on this board for 9 years now, a record. I'm in my grace period, which is kind of like the 9th year. I've learned a lot, and I've attended the board meetings for a long time as well, before that through CVMA. I've been through 3 executive officers and 4 legal counsels. And I think Jessica's furiously typing something, so I'm going to stop before I embarrass myself. Because I'm pretty sure I'm out.
Actually, that's what I was clarifying, because you have a year grace period. So you are still able to serve your year grace period unless the governor's office has thanked you. So I'm hoping we still have you for another 6 months.
Okay, my bad. I thought this was my last meeting. You know, based on how I've conducted this meeting, maybe this should be my last meeting. So anyways, I thought I was out, but apparently I'm not. So that's the end of my report then. How embarrassing. I'll come back when it comes to national involvement reports. It's late in the afternoon. No one's watching anymore, so it'll be fine. Let's just move on to Jennifer, who will give a much more professional and prepared report.
You're doing great. Don't worry.
It's been a tough year for all of us.
Okay, so I feel like I'm late to the party with this because my report is, Thursday at the end of the day, but happy National Veterinary Technician Week to all of the technicians. One thing I did want to point out, we appreciate all members of the veterinary team, no matter what they do. But traditionally, most veterinary hospitals I know celebrate the entire support staff as a group. And this year, NAVTA was specific in their wording that the week of October 17th through 23rd has been set aside as National Veterinary Technician Week to celebrate, recognize, and promote the valuable contributions credentialed veterinary technicians make to the veterinary profession and society. So it is very specific that it's Credentialed Veterinary Technician Week. So happy RVT Week. Not to leave out the rest of the staff, there actually is a Veterinary Receptionist Week in April. So there are opportunities to celebrate everyone, but specifically want to thank the Registered Veterinary Technicians of California for everything they do. It has been said that we're going into the junior year of the pandemic, so we're all terrified to see how this progresses. But we do know that there is such a staff shortage for every veterinary professional of any title, and everybody is so burned out. So it was suggested that, we do more than pizza and donuts for our veterinary technicians, really thank them, appreciate them, and let them know that they are valued. Speaking of the staff shortages, that's pretty obvious. We've heard from everybody that it's, difficult to get staff coming into their practices to work, veterinarians and technicians. Veterinary professionals, but specifically RVTs, are leaving the profession in volume numbers. They're just so burned out, and we can't get them into the industry faster than they are leaving. So I really want to make sure that we are utilizing them. The AVMA did have a publication in honor of National Vet Tech Week about utilizing technicians, making sure that they're being used to their potential value. And one question was, how do you know if you're tapping into your technician's full potential? And the best way is to ask them directly, what could they be doing? Is there something they need more training and guidance on? But we do know that RVTs do have those tasks that are specific to them, but there is an opportunity for more. So I have mentioned extended duties for RVTs. If we recall, that was an agenda item with the board and then with the MDC years ago. It was not successful. It died on the table. But it was mentioned today, possibly expanding the roles of the veterinary team to help with shortages. So that's something that we can keep in mind. I know with the Access to Care Committee, that was something that may have come up as well. Another thing I do want to mention is Rbt Retention and Burnout, because the theme of National Vet Tech Week was self-care. And I did see an article that was published in some publication about the shortage and the workload. And an RVT that I knew was actually interviewed and said that because of the workload and they're not able to have clients come in some cases, turning clients away, some of the clients are getting abusive, whether verbally, sometimes even physically. In this case, somebody threw a milkshake at her because she said that they couldn't see the patients. So I really want to emphasize that every member of the veterinary team is valued, but it's generally not the veterinarian who's going into the parking lot and talking to these angry clients. It's the veterinary technicians, it's the assistants, it's the receptionists. So I really want to, there's nothing the board can do, but I want to make sure that everybody is taking care of themselves. I have heard of a lot of veterinary clinics closing on weekends, closing for an entire week, just to give everybody a break because they are so overwhelmed with the workload. Another thing is that something that goes along with retention and burnout is the technicians feeling valued and appreciation. So there was kind of a social media outrage that a veterinarian had requested a professional discount from a popular exercise equipment company as a healthcare professional, and it was not honored because this company said that only includes real doctors, and there was a lot of outrage on that. And that got me to thinking about how the RVTs are viewed, because we are veterinary nurses, for lack of a better term. And I did look at some of our associations because, again, within the purview of the board, we regulate the practice of veterinary medicine and licenses. There's not a lot that we do to promote the profession. That's what our associations do. And I really do want to thank CARVTA and the CVMA, who are at every single meeting. NAVTA is obviously a veterinary technician association, but some of the other local associations I was looking at, there was some concern about them representing veterinarians, and maybe veterinary technicians are included. But Dr. Nunez had mentioned a podcast, and I did actually listen to a podcast. I have about an hour commute to work every day, so I do a lot of just sitting and nothing productive. So I was listening to a veterinary podcast put on by a veterinarian and a credentialed veterinary technician. I believe they're outside of California, about some associations that maybe should be named the Veterinarian Medical Association rather than veterinary, because they don't include every member of the healthcare team. And one California association I had looked at as far as membership has a membership title for veterinarians and then paraprofessionals, and that included RBTs. So I looked up the definition of paraprofessional, which is a person to whom a particular aspect of a professional task is delegated, but who is not licensed to practice as a fully qualified professional. So when we're thinking about how maybe veterinarians are viewed in the industry, we have to think about that as technicians as well in our own profession. We're not always viewed as veterinary professionals or healthcare professionals. And unfortunately, again, the board can't do a lot about that. We really need to ask our industry associations to do more. So again, CVMA, CARVTA, and NAVTA do such an amazing job of making the RBTs feel valued. But the one thing that I did hear in that podcast, the analogy was, we have a seat at the table, but we don't have a plate as RBTs. So I really ask the industry associations to do more to appreciate those technicians. It's very difficult to get them through school, to get them licensed. There are a lot of barriers. I really want the RBTs coming into the field to feel that they are valued. So if I can ask the associations in every state, but mostly in California, to please do more to help the veterinary technicians. The last thing on my report is board representation. So it was brought up at a previous meeting about possibly adding an RBT to the board. And I do want to point out that I am the only RBT. I am the only voice for RBTs on this board. We do have 4 DVMs. We now have the 2 student liaisons from the veterinary school. So it's wonderful that we're getting such input from all of the different aspects, but mine should not be the only RBT voice on this board. So I do want us to keep that on our radar, that we actually consider adding an RBT. And along with that, I will say, I've mentioned this earlier today, Christy Pulowski just had her last meeting as MDC chair. For the last couple of years, it has been an RBT that has shown strong leadership for that committee. We do have a very different makeup of the MDC than we did from when I was appointed to the board. And without the RBT leadership from Christy, we would not have been able to continue with that board. She just did such an amazing job. And if anybody watched the MDC meeting yesterday, it was asked, is anybody interested in serving as vice chair? And really, there was not any interest. We are all swamped right now with work. And it was yet another RBT, Leah Schufelt, who stepped up and volunteered to serve as vice chair. So the RBTs absolutely have a voice in the regulatory world in our MDC, but I want to make sure that we are appreciating our RBTs and that we're doing our best to have representation that's more than just mine. So that is actually all I have for a change. Does anyone have any questions?
I'm sorry, I do have one question. When is the receptionist week? You said April or?
April.
Okay. I have not heard of that yet, so I thought I'd ask. And I have one other question, because I thought in the notes, I went and looked at the chat and it seems to be gone now, but I thought Nancy Ehrlich had brought up something about just continuing the VA CSP because we have such an increase in RVT numbers. She said something about 2.3 per practice now, but now did I misread that, or is that?
I think that may have been mentioned, but as we were talking about earlier, there's data that we need to see. And I think a lot of that may have been before the pandemic. So there's just been a lot. Everybody's so overwhelmed that they're just, and if you look at the RBTs that are on the committee and that are on the board, we're not actually working in practices, we're doing something else. So there is still a need. There's always going to be a shortage of RBTs if you ask me.
Right. Okay, good. Thank you. Thank you for your report.
Any other comments from the board? And comments from the public, please?
All right, this is the moderator. I'm opening up the Q&A panel, and if any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. And we are displaying instructions. All right, Anita Levy-Hudson would like to make a comment. So Anita, I will give you permission to unmute yourself. So you should be able to do that now.
Thank you so much. Thank you so much for that report. I definitely wanted to add that you definitely hit on a lot of topics that we at Carvda are keeping our eye on too. Thank you so much for the shout out. We do try very hard to make sure that we have good representation. And I just wanted to say thank you for that. I wanted to add to the numbers of the RVTs. It's something that we discuss constantly because there seems to be not only an issue with the numbers, but the longevity in the field because the life expectancy is so short. And I wanted to add to that some of the feedback that I hear and that we're trying to address is that they're, as we talked about utilization not being as good as it could be, but also simply the cost for the education is so high, it doesn't equate to the pay that they're received, that is received. So there's a lot of different factors that tie into that. I mean, and that's a lot of things you're going to be hearing us talk about in the next year. Title protection, that would be huge, especially when it comes to talking about expanding duties. We're very excited to have more talks about that. And I'm really, really glad to hear all that on your radar. And I just wanted to extend a thank you for hitting those points for me. Oh, and I almost forgot to say, the Peloton thing, oh my goodness, the discount for the veterinarians, they did just today come out and say, and they included veterinarians and assistants. We were not even mentioned in their retraction and their offer for a discount, but it gave a snapshot of the work that we need to do to educate the public. So that is definitely on our list as well. So thank you again for all that you reported on, all those points that you hit on. I'm glad to hear that they're still on your radar.
And I wanted to add one more thing because Anita reminded me. I had a conversation with somebody who teaches in an RBT school who said that it was basically job security because they're getting candidates through school and they become RBTs and then they practice for a couple of years and they leave the profession. So maybe at a future time we can look at actual retention of RBTs in the field for another day.
Any additional public comments?
This is the moderator and there are no additional requests for comment. Would you like me to close the Q&A panel?
Yes, please.
Okay.
Thank you, Jennifer. Your report was so much better than mine. Moving on to the next agenda is 14 National Association Involvement Reports. This is Kathy Bowler and I. This is what I was referring to. The American Association of Veterinary State Boards had their annual meeting in Denver, and it was sort of a hybrid meeting. Everyone was invited to participate in person, or they were given an option to Zoom in. And a majority of the people came in person. I think they had 47 different states that were represented there. Canada still had travel restrictions, so we didn't have any of the Canadian representative there, but it was a pretty well attended meeting. We did put forward a candidate. We put forward two candidates. One was some guy that was trying to run for the board of director position. That was me. And our other nominee was Kathy Bowler to be reelected as the public representative to the ICVA. My campaign was unsuccessful, but I do think that we've made an impact. I think the pandemic has turned the world upside down, and it has placed challenges on our profession. And with any challenge, we need to adapt to it. And adoption is going to involve regulatory changes. There's going to be other groups that are out there that are wanting to take advantage of the situation. There's lots of venture capital money out there to try to get involved in our field. The only thing standing in their way are those pesky regulators. So a lot of these issues were being discussed, and California just feels we need to be at the table to just have a voice at the national level about regulatory issues that are going to face us in the next several years. So I may have been unsuccessful in this bid, but I think that everyone went from California. It was myself and Jessica Sieferman and Kathy Bowler and Christina Bradbury and Dick Sullivan. Did I leave anyone out? We were going to have legal counsel represented, but there was some conflict that didn't allow Tara to attend. But the other, they talked about, it's a convention, so there's workshops and speakers and so forth. Some of the issues that were talked about was the impact on COVID on our profession, how to run an effective virtual meeting, pharmacy laws, the impacts of telehealth on our profession, changing climates of complaints in veterinary medicine, reinstatement of licensure after extended absences, the future of hemp-derived CBD use in companion animals, and always a crowd favorite, top recent legal cases. I'm proud of California because I think that many of the issues that are talked on at the national level, we're a very progressive state, and we've talked about these issues before. And the other thing that I always find a little amusing is when I talk to some of the smaller states and how many complaints they receive on an annual basis. I think Rhode Island has about 4 pending complaints right now that they're dealing with. Did you hear that, Rob? They have 4 pending complaints that they're dealing with.
Oh, I heard you. I heard you.
Rhode Island. But it was interesting. Kathy, do you want to add anything to our meeting experience?
Yeah, sure. Thanks, Mark. Yeah, I mean, again, we shared disappointment that Mark was not elected. There were runoffs, and Mark was in the last runoff. But it would have been very healthy for the AAVSB to have a board member from California, the largest state of licensees, et cetera, et cetera. But we're going to keep plugging away. Mark was very effective during the meeting and very, and was involved at all levels of the meeting. It's just unfortunate he did not win this time. He did ask for an audit, I believe, and I believe they're going to take all the ballot boxes and the machines into a warehouse and recount all those votes. So we'll see what happens.
Arizona, recount Arizona, please.
Yeah, exactly. I do a couple of things. One, again, it is very important for us, even though we're kind of our own island and our own nation out here, but I think it's very important. And we have seen in the last few years, if we're not at the table for whatever reason, whether it's because it's in a state that we cannot go to because of our state laws on that, or we're just not there for other reasons, they do things that may impact us, and our voice is very important, I think, because what Mark said, we are progressive. We are looking at a lot of these complex issues and have been for years. And even in their program, the program that they put on, Jamie's been there before, Cheryl's been there before in the past, and often their presenters are pretty one-sided, and they don't present both sides of an issue that is a very complicated issue. And one of the things that we're trying to do, and Jessica particularly, is get more involved in the Executive Officer Association and more at the table on these presenters. We're going to write a letter again this time after this last meeting with a couple of points and comments and criticisms, constructive, et cetera, from our board to the AAVSB board. So hopefully they'll take all that into consideration. I did want to say one thing about, it's somewhat in the outreach section that we'll see tomorrow, we'll do tomorrow. Jessica's got a little bit of that, but I want to commend Jessica because this was, part of this meeting was to elect the new officers for the board of directors for open positions and representatives to the ICVA. They did what they didn't do before, virtual Zoom interviews with everybody. Mark was very good, and actually, too bad we don't have the link, Mark. We could give it to everybody so they could see it. But at any rate, and
we
Jess,
do. I can send it.
do okay then.
Very high production quality.
It was, yeah,
And the
and
best of all the states.
I tried to get on quite a few of them to watch them, and because people weren't going to maybe even be at even at the meeting, these were done the 2 or 3 weeks in advance. Jessica, because part of our strategic plan, we talked about being more involved in the in national, well, it's Canadian and U.S. association. Jessica participated in almost every one of those Zoom interviews, asking what were very good questions of the candidates. And I think it was well received by the AAVSB staff because hardly anybody else got on those things to watch. I watched them, but I didn't ask any questions. So Jessica should be, as once again, commended. I don't know how, there's not enough hours in her day, but she did that with almost, I think, every single one of those candidates. So anyway, that's really what I wanted to say about the conference. And we did have a good California presence, including Dick, who also served on a couple of committees. And that's it, I guess.
You know, I failed to mention that Kathy did win her nomination to be reappointed onto the ICVA. And not only that, she's going to be the chair of that committee this coming year. That's correct?
Yeah, the chair-elect for the next year. It starts next year for the ICVA. It's a 1-year term.
So Mark, that's because she had her Build-A-Bear with her and you didn't have yours.
I'm going to grab my Build-A-Bear right now and show it to you. Do you have any report on the ICVA?
My ICVA report is quite short.
Sorry, real quick, before we go to that, can I just add a little more for the AAVSB meeting?
Yes.
Sure.
Okay, so and Kathy, you kind of touched on it already, the letter that we're going to have right from the executive committee to AAVSB regarding some concerns that the board had. As Kathy touched on, as part of the board's strategic plan, we had concerns about prior presentations from AAVSB to the Association of Regulatory State Boards, that they were very one-sided. And so I did make a point to participate in all of the interviews and to let them know and provide examples of what our specific concerns were. We feel that it's very important when you're dealing with a controversial issue to have fair and balanced information. You bring views from all sides for the presentations, and that was lacking on the last one, and this one was lacking as well. There were presentations regarding telemedicine that were not only one-sided, but contained a lot of just wrong information. There was a veterinarian who was from California who talked about waivers and had said that there was a waiver that was granted for veterinarians to establish a Bcpr via electronic means. That was not correct. She went on to talk about how she was doing that, and then she had said how the board then removed that waiver and removed her ability to do that, which is also not correct. There was some misinformation about her title and involvement in doing some telemedicine guidelines. And so it was very concerning that the information being provided was not only one-sided, but wrong on so many levels. I do want to commend Dr. Nunez for going up there in front of everybody and clarifying politely the record of what the waivers did, who issued the waivers, and what the waivers did not do. He received a little bit of pushback, and Dr. Nunez, again, respectfully corrected the record for everybody. There were also concerns about presentations that rather than discuss the regulatory side of things and what board can do for protecting consumers, seemed more like sales pitches to veterinarians. That's not the place for AAVSB and not part of their mission. And so we're concerned about that as well. There was also a concern because their next meeting is going to be in North Carolina, which is on the list of states that the board cannot travel to. So there were discussions. This AAVSB meeting, it was a hybrid, but there were discussions about it not being a hybrid going forward because of the cost associated with it. Obviously, that's a concern for us because we need to be part of these conversations. We've learned firsthand what happens when we don't or aren't able to participate. And so that's a huge concern for us to not be able to participate next year. And so we're in the letter also going to request that they keep the hybrid option so we can still continue to participate in the conversation. I think that covered those concerns that we're going to share with AAVSB. I've also talked to a couple other executive officers of other states, and we're going to go through some of the bylaws of AAVSB and potentially recommend some revisions to the bylaws as well. The other thing, the takeaway from that during one of the presentations from the AAVSB legal counsel was to change the way that state boards are providing their meeting minutes, and made a suggestion to instead of doing transcripts and type minutes, to convert them to more action type minutes. I think most of the board members who were here when I first started, I had brought up that idea to convert them to action minutes. There were some concerns with that, but given the AAVSB is now raising it again, and Dr. Nunez seems to be more open to it, I wanted to bring that back up to the board as something to consider. The meeting minutes themselves take a very, very long time. I think it's estimated that it takes Justin about 4 hours for every 1 hour of board meeting to transcribe. So if we have a 12-hour meeting, that's 48 hours for Justin to put together. So it's extremely time-consuming, and I believe we can accomplish the same objectives by providing links to the very start of the conversation and providing links to the actual motions, and then also links to when the final vote is counted. We would record the actual vote in the meeting still, and if anybody wants to see exactly what the conversation was, they would be able to access it quickly through the links that would take them right to that start of the conversation. I know that there's some concerns that it won't be as detailed, but the reason why the attorney from AAVSB brought it up is because you run into some issues where a few things could happen. You could have board members who are not happy because a statement was left out, or they put a statement in there that they did say they maybe not have met in that context, and so they didn't appreciate it being in the minutes, and it's very hard to pick and choose without going to a transcription type minute. And so I wanted to bring that back to the board for consideration to convert it to action minutes. That's all. Oh, and then I did want to clarify, because you mentioned legal counsel. So we were hoping last year, actually before the pandemic, so the one before that Tara, we would be able to have Tara there. However, it turned out that all of the positions that we went to, we were able to go because it was fully funded, but AAVSB did not fund for legal counsel to go. So we didn't have the funds to have Tara go, and that's why she wasn't able to participate.
First of all, here's Regulator Bear. I still have Regulator Bear. And I want to clarify that we do have a great relationship with AAVSB. They do a lot of very, very important things. They're an association that exists to support regulatory bodies such as our own. They're the ones that prepare the veterinary national exam, the RbT exam, and there's other programs that help us process or get information on licensees from other states that are transferring to our states, if there's any disciplinary actions or anything like that, it's very useful to have an association like that. But they're just a little out of touch with, we feel a little left out. I think the final slap was that when their legal counsel was presenting cases, he said he couldn't find our case that we have before us because it wasn't, he just didn't know the title of the case. And that's being a little out of touch. The action minutes that Jessica is talking about, can we just motion for that to occur, or is that doesn't involve any regulatory or anything like that? Is that right?
No, if I get a consensus from the board that they would be open to trying that for the next meeting, then we can just go ahead and do that.
Okay. It does take an awful lot of staff time to prepare the minutes, even though they are beautiful minutes. So what action minutes would be like is basically you would have your agenda with timestamps on the different agenda items, but it would still record the vote count on any motions that are being made. And I wasn't amiable to the idea when Jessica first came on board, because I was still traumatized about getting a new executive officer. But I learned that Jessica is always correct in so many things, and I'm in full support of it. If I see some hands raised, so I'm in support of it, Dr. Nolan, and then Kathy.
Thanks. Yeah, I'm happy to try it too. I think it's a good idea. But I missed something, Jessica. You said something about the AAVSB was delving into something that you thought was outside their perusal or their what were you talking about again? It's been a while back. Sorry.
Yeah, so I think it comes down to the if you think about the position of the board and maybe make a comparison to the professional associations, our mission is consumer protection. And so we want to know from AAVSB the best ways to do that through improved regulations and statutes, and learn about some successes and some challenges, rather than have a 15-minute sales pitch on CBD and why veterinarians should be using products from the presenter. I think that there was some clear conflict of interest that potentially violated their own bylaws, but I think that we should look into further. They're also starting this what they called an elite Rbt certificate, basically promoting the profession of the RVTs, which I think is a novel goal, but something that should be driven by a professional association, because the regulatory boards aren't here to advocate for the profession. We're here to advocate for the consumers and protect consumers. So I think that there's a line when it comes to professional associations and regulatory boards, and I think that line is becoming more and more blurred as AAVSB continues.
Great, thank you for that clarification. And one other quick question: if we go to the action-based minutes, we'll still have access to the full webcast, so that would be available for the public as well. Is that correct?
Absolutely. And so what we would do is not only keep the links up available on our website and YouTube, but we would also download the video, so we always have access for them, because we can't control if YouTube takes the video down. We want to make sure that these minutes are always there, always available, should the public or anyone want to find that information.
Kathy, did you have your hand up?
I did. Couple things. One, I want to again touch on what Mark just said. A reminder: we may have issues with some of the presentations at the meetings, but AAVSB staff and the resources they provide are very useful for regulatory boards, particularly boards that don't have the staff that we are fortunate to have. They provide great, compile what's going on legislatively, countrywide, what different boards do. Their resources are useful, and they're very responsive to us. So we appreciate being a big member of theirs. And we just want to, and I think the other thing we found in the last few conferences that we've been to, where there have been presentations that we personally felt were one-sided, we weren't alone. Lots of other boards and jurisdictions from Canada and the US were talking the same way. It's just that maybe because we're California, we're more likely to send a letter and print it out to them. Anyway, I will say that it is troubling that we can't go to the meetings, or especially next year in Charlotte. But we'll hope that it is going to be hybrid so that we can at least participate, vote, and speak up, and hopefully impact some of the presentations a little bit more. But again, AAVSP as an association is very, very helpful.
Yeah, I was hoping to have a mint julep in North Carolina, but California has some travel restrictions. Do we want to? Is anyone opposed to trying action minutes for the next board package?
Dr. Bradbury has her hand.
Is that?
Yeah, I'm not opposed to it. I just am not sure how it works. It sounds kind of clear to me that it's just basically some brief kind of bullet points and then with links to the video, so it takes you directly to that if you want to see what people actually said. Are we going to have to approve that at each meeting? So we're going to have to look over and listen to the meeting again?
No, you would still do a motion to approve, but you're just approving the content of the action minutes. So you just approve basically the votes as they were counted.
Okay. And then I see on this meeting that there's a running transcript at the bottom of the page, at least on my WebEx. Is that on everybody's? So is that something that can be transcribed? I just wondered, does that, or I'm happy to go forward with the action minutes. I just see that it's being recorded and written down and with some spelling errors, but
it's a closed captioning.
We'll send a PDF of that to your house and you can print it out.
But you can control it, Christina. Down in the lower left-hand corner, there's a little box that you click on.
I was a little bit taken aback, Jessica. Did you mean to imply that at any moment YouTube can take down all the webcasts that we've done? It's in their hands?
We don't have control over YouTube, and so it's their videos and that are posted, and so that's a possibility.
Wow. Wow. My entire presidency can be erased, huh?
I can't believe there wouldn't be thousands upon thousands of hits about our on our meetings. I'm so shocked. Hundreds of thousands, millions.
Okay, so I think it's agreed that we can try the action minutes for the next board package, and if you love it or hate it, then you can decide at that time. And do you have any reports for the ICVA?
No, all I was going to say is I believe we all received it, but the ICVA annual report was sent to all the boards, provinces, and state boards about 2 weeks ago, and I believe Jessica's sent out to all of us. It has all the stats. ICVA has extended the testing window, the fall testing window again, through December 31st. And good news, given the fact that there is such a shortage of veterinarians, the amazing thing with all of the Prometric location shutdowns and all the problems with the schools and the colleges and everything else, in the 2021 testing windows, the ICVA NAVLE was taken by 6,000 some odd applicants, as much as ever before, and there was no decrease in it, which is fortunate since we need veterinarians in practice, obviously. So anyway, that's pretty much it for the ICVA. It has all the information in that annual report. And our next meeting is in January, possibly in Florida, but who knows? Either in Florida or my living room, whatever.
And the member and program service think tank committee, that's a committee that I'm on. Now that I'm still a member of the board, I guess I'm still on that too. There were really two topics that they were discussing. One was streamlining the NAVLE eligibility process. And when an applicant is applying to take the national exams, in the past, they had to first go through their state and then apply at the national level. And the streamlining is removing the state portion of it. There are probably reasons why it was there, but that was even before my time, why it was there. And I'm looking forward to when they're going to streamline the streamline process, because it's still a little bit confusing in my opinion, but that's going to happen. And the other big topic that they talked about in that committee is related to RBT task and training and levels of education, and which is going to be an emergent issue. But I always have to remind them that you also have to talk about the economics of it, because it's going to have to come with increases in pay. It's definitely deserved for them, for the work that they do, and especially if they're going to be going through extra education, there needs to be extra pay in that. And that was it for my report. Any questions from the board in regards to the National Association involvement reports? And we can open it up for public comment next.
All right, I'm opening up the Q&A. And if any member of the public would like to comment on this agenda item, please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions. All right, I see no requests at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
And by the way, for any board member that doesn't know, the AAVSP does do little field events. I think it was in Milwaukee. We had a meeting one time, and is it Milwaukee? That's where Build-A-Bear was
St.
started.
Louis.
St. Louis. That was Build-A-Bear was started.
Yeah.
And so everyone was able to build a bear, and it says regulates well with others. So it was cute. And in Denver, we went to the Denver Zoo as our entertainment night. But it was really dark, and they didn't turn on much of the lights, so you couldn't see any animals. All right. Next item is a new item, agenda item 15, student liaisons report. We will start with UC Davis. Amanda Ayers, welcome to the board.
Hi, everyone. Everyone can hear me, right?
Yes.
Perfect. So obviously this has not been done before, so neither I nor you knew what to expect. So I'm gonna start off by just talking a little bit about what's going on at UC Davis, and then I'll open up for questions from you guys, whether you have questions about what's happening at the school or whether you have questions about me personally. So first of all, I wanted to touch on the pandemic. We instituted a vaccination policy that went into effect on September 8th. Since then, 99% of UC Davis students are policy compliant. So either they got approved for exemption or they got vaccinated and have waited that 2-week period, so they're fully immune. There's 1% that's still in progress, but we're hoping that the in progress means that they're just waiting for that 2-week period. So that's great. 89% of employees are vaccinated and 95% are compliant as well. So that's great. We've also instituted a testing policy which complies with California state law. So we are requiring that all students who are vaccinated get tested every 14 days. We have a lovely kiosk set up with salivary testing. It's phenomenal. Our staff run it. It's super fast. I mean, it's 3 minutes in and out. This week we had over 22,000 tests that were taken and only 15 were positive. So we're looking at a positive rate of about 0.07%. So very excited about that. This does include our undergraduate. So there's not a vet specific one, but we're included in that. The second thing that is going on, we recently started construction on a new all species imaging center. So that is a project that started just this past week. I believe I think they broke ground on Monday. So brand new. It's supposed to be completed by spring 23. We will see if that goes. It was about a $23 million project, and the idea is that it's centrally located so that the large animal and small animal, as well as exotics, can all access the facility, and it'll have state-of-the-art CT, MRI, PET scan, all that good stuff. And lastly, the vet med community, we are recognizing that there was a new dean. So I'm a first year, so I did not know any of the deans who were before him, but Mark Stetter is the new dean at the School of Veterinary Medicine. He officially stepped in as dean rather than interim just this past week on the 18th. And so he will be replacing John Pascoe, who is serving as an interim, and then I'm sure you guys knew Michael Larimore, who stepped down in July. That's all I have.
So thank you for that. So veterinary students are very different from Southwest airline pilots and Chicago police officers in their belief in vaccinations. I'm not surprised to hear that. Any questions from the board? Okay, this is where it really gets fun. We're going to open it up to the public.
Oh man.
Or any public.
All right. So the Q&A is now available, and if any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions, and we'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Thank you, Mandy. You did a great job. And thank you, Dr. Pascoe, for holding down the fort in the interim. You did a great job too. Moving on to agenda item 15B. Western University. Christina Youngans. You have to tell me how to pronounce it. I'm sorry.
Yeah, can you guys hear me okay? Great.
I can hear you, yes.
Yeah, if you read that J as a Y, it's young, and then read the last part like Hans Millennium Falcon, so Hans, young Hans.
Young Hans, got it.
Yeah, that's the best way to kind of quickly tell people how to pronounce it. It's German. But yeah, so my name is Christy Younghans. I'm a second year student at Western University. I was just going to start by telling you guys a little bit about me. I'm actually originally from the Southeast. I was born in Atlanta, Georgia, so I'm kind of new to the West Coast, but I'm happy to be here. I attended Auburn University and graduated in December 2018. Prior to vet school, I had experience kind of all over. I did some research, and I like to spend my spare time volunteering. I have interest in specializing, but I know more about what I don't want to do than what I want to do, so I'm still figuring it out. I'm in a few different leadership things at Western, which was one of the reasons why I'm here today. I serve as the SGA curriculum representative. I work with SAVMA, as well as our student chapters for ACVP and HSVMA. So I feel like I get to mix a lot with the different classes and different people in those classes. So as you can tell, I like being involved. So I'm really happy to be here in this new role. I wanted to kind of tell you guys what's going on with us. And actually, as Amanda, or I think you might go by Mandy, we also instituted a vaccine requirement, and 100% of the students in the College of Veterinary Medicine have either been fully vaccinated or approved for exemption. I believe those with exemption were a small amount, just a few. I did want to kind of give a quick insight to our curriculum and kind of what's been going on. Last year, we were completely online for years 1 and 2. So yay, I got to complete my first year of vet school online. That was a new experience. Years 3 and 4 were hybrid. This year, year 1, 2, and 3 are hybrid. So that means that currently I'm taking anatomy and clinical skills labs in persons, as well as the other second years and first years. But things like our basic science lectures, molecular and cellular biology, our problem-based learning meetings and grand rounds are all online. For year 3, they've been doing some rotations online for the first quarter of the year, and then the rest are going to be in person. And then year 4 is in person, which is site dependent. I know some rotations, like pathology and radiology, have been completed online. So I did want to kind of take a moment to highlight all the students' efforts in a virtual world, because I feel like we've really, I don't know, had to go above and beyond to connect with the rest of our class. So we have a SAVMA Wellness Committee, and they've been taking time to put together mindfulness sessions and yogas with our faculty. We've been doing midterm week support, where you can submit, and then they disperse motivational notes and giving out self-care goodies such as tea, face masks, and coloring books. SGA has also been doing a lot of effort to connect the class. We have weekly vet games that's coming up next week. Actually, we have different themes and games and competitions, and we've actually had good participation with that, even being virtual and hybrid. We do fun dress Fridays to try to keep it interesting. We have a class cup to keep participation up. So we have people compete for points by staying involved, and then give out, small rewards like, pizza and goodies from representatives. And we've also been sending out Monday emails, so SGA survival guides, kind of helping the students stay connected on what to expect that week, especially with all the different Zoom links and in-person classes and lunch talks, and just trying to keep everything on the same page. I also wanted to take a moment to kind of highlight our student chapters. They've been doing an amazing job. We've had the opportunity to hear from speakers all over the world because of the pandemic and things being conducted virtually. We can attend conferences we normally wouldn't be able to. And we've even been raffling gift cards for lunch and dinner talks due to save funds from not providing food in person. I know that I was asked about some of the biggest mountains we are facing, and so I did want to take a moment to kind of let you know what's on our mind from the class, that what I've heard over the past year and recently. I know that I've heard a lot about people wondering how the online and hybrid curriculum will affect our learning outcomes. Our assessments have been kept the same level of difficulty regardless of the learning format, and we still have performed well. But I think many students are still unsure. I'm not sure if this is a normal feeling or maybe exacerbated given the pandemic, but perhaps we won't really know until it comes time for the NAVLE. So I also wanted to highlight the next level of concern was cost of education versus career outcomes. The increased demand for veterinarians, the lack of support staff available for veterinarians, and the change in dynamic between provider and client. Those were all kind of the big topics that I heard from students that they were the most concerned about. And there are some suggestions of, how they want to proceed. So I'm excited to be here to be able to help kind of deliver some of those suggestions and comments as a liaison and not necessarily a single individual. And now I'll take any questions.
Dr. Nunez, you're muted.
Dr. Bradbury, is your hand up?
Yes. Yeah, I actually, I just wanted to welcome you both. And we're super excited to have you participate in these meetings and sort of help to bridge the gap between the board and the future veterinarians' perception of the board and what we do. And I think it's a little bit of a mystery until you kind of participate and pay attention to it. So I think it's a really valuable role that you guys are playing, and it'll be interesting as it evolves. And then I wanted just to say that it probably is a normal feeling. If you're wondering, I don't know if this is enough to be a good veterinarian when I get out of all of this. I think that we're kind of wired that way to always wonder if we're good enough. That's kind of drives us to do better. So I'm guessing it's a normal feeling, but I can't say for sure because I'm not in your shoes. But anyway, I just wanted to welcome you guys, and I'd be interested to, hear what both of you are looking for in your participation and what you hope to gain from your role here.
You both gave a great presentation, better than my presentation this time around. One last question I have, if you both want to unmute your mics. I'd be interested in knowing just some brief comments of what you think the future of telemedicine is in veterinary medicine. A few words on telemedicine, please.
Sure. I'll get started on that. It's hard to say exactly what will happen since we don't know where technology is going to take us. But what I can say from a consumer standpoint is that it's helpful to have that telehealth option when you're a student. And I'm sure it applies when you're working, especially if you don't have a clinic where you could bring your animal in and just have them be taken care of by your fellow employees. But I do think that it kind of goes hand in hand with the RBT and defining the roles. I think that telehealth has its place, but that it doesn't necessarily need to rise to the level of diagnoses. I would say more for general questions, things like maybe for sending pictures of gross things. I say gross things, but I love it. Like the difference between hematochezia or melena, that kind of thing. Just to kind of help owners guide whether or not they need to bring it in. I know that's a big question in the community, is just, is this an emergency? Do I need to bring my dog in right now? So I think telehealth has its place there.
Is it Mandy or Amanda, by the way?
If you ask my mother, it's Mandy, but my professional aura is more of an Amanda. It's on my birth certificate as Amanda, but you can call me either. It doesn't matter.
It says Amanda on the agenda and Mandy on your screen.
Yeah, we'll go with Mandy just because that's what my colleagues call me. So
okay, and you're one of our colleagues now.
I was gonna say I agree with that statement. I do know that in some cases I feel like it could be really helpful as far as access to care. Even under normal circumstances, outside of a pandemic. Even things like checking incisions. Using photos and email for that versus somebody having to find transportation. That can be a task for some people in our communities, and so I do think that it could help a lot. The biggest question is where you draw the line of when you can help via telemedicine versus when you need to see it in person. And I'm excited to kind of hear everybody else's opinions on this that have kind of been practicing for a while and see what they think. But I definitely think that it's in the realm of possibility, at least to some extent.
Great, thank you. it's the beginning of an incredible journey. I think you'll learn a lot. I would encourage you to sign into the MDC meetings, which usually occur right before our board meetings. That's where they get into some really, really heavy duty discussions. They do the real hard work, and it's very informative. You'll learn a lot. So we have now come to the point where we are in recess, and
Hey, Mark.
Kathy's
yes.
hand is up.
Oh, I'm sorry.
That's okay. It'll be very quick. I just want to thank you both and welcome you. We're very excited to have you and know that your time is limited with your coursework, your clinic, everything else. Not to mention, oops, just kicked a dog. So, a Great Dane underneath me. He didn't even notice. Anyway, we really appreciate this. Is our first opportunity at doing this as well. You are our inaugural student liaisons, and we hope that you will gain something from sitting in on these, 8-hour meetings, et cetera, et cetera. And we know we will gain something from your presence. So thank you very much. And please feel free to ask any questions anytime.
Any other questions? Oh, we didn't open up the public comments for the Western representative, I don't think. If we can do that really quickly for fairness purposes.
All right, so the Q&A panel is now available, and any member of the public that would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions, and we'll give you a moment. All right, I'm not seeing requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you very much. Just a reminder for tomorrow in closed sessions, we're going to be doing evaluations of the executive officer. In the past, what we used to do is have you fill out your evaluations and send them to me, and I would collate them, and then we would talk, but the DCA recommended that we not collate them beforehand. So just make sure that you fill them out and bring them to the meeting tomorrow, and then we will come up with a consensus on the evaluation. Any other issues that we need to talk about, Jessica?
No, we're good.
Okay. So we are in recess until tomorrow morning at 9 a.m. Thank you, everyone.